Hello, this is Dr. Adam Akers from Akers Family Chiropractic. We are coming to you today with a short, informative video of some commonly asked questions that I get all the time. You know, as a chiropractor, when I'm out in public at a ball game or some type of event, I got countless people coming up and saying, "Hey doc, I've got this shoulder pain or this discomfort, and can you help me with it? Give me some advice." And you know, legally we can't give you free advice across the internet because we haven't had the opportunity to examine you. But I want to kind of build some bridges of informative information so you'll know more about your condition. So first of all, some commonly asked questions is, who are you? And I'm Dr. Adam Akers from here in Pikeville. I went to Virgie High School, actually went to Eastern Kentucky University with my pre-med, and attended Sherman College of Chiropractic for my chiropractic degree. I've been practicing 21 years here in Pikeville. And so blessed by the good Lord to help so many people with so many different conditions. So I want to kind of dive into some basic commonly asked questions. First of all, the question I get by far is, do you accept insurance? And yes, this clinic accepts all forms of insurance: Medicaid, Medicare, Major Med, car accident, workers' comp. Any type of insurance you have, we accept. And here's the kicker: we do not need a referral from your general practitioner. So how do I get your service? You simply call 432-8395. We will give you an appointment either that day or the very next day, and you'll get in to being examined. Now we want to kind of cover some things of what happens during that first examination. That first examination is very typical of what you're used to with your general practitioner. Is once you come in, you'll fill out a case history sheet. To diagnose you, we need to know your past history of everything going on, what you're complaining of. Here's a big common misunderstanding. Back pain can be caused from many different things. And just because you hurt in one certain area, that's not necessarily where the problem's coming from. So that's the reason we can't give free advice, because it seems common to you of, hey, I have pain, can you fix it? Well, there's multiple factors. So the first thing you need to do is have a thorough examination. And during that first visit, what we're going to do is take that case history. We're going to see some red flags that could be causing the condition. We're going to do orthopedic tests of taking your joints through a certain range of motion to determine where the pain is coming from. And after that examination, we'll probably order some x-rays, MRIs, CTs, blood work, whatever it needs to be done. Commonly asked question is, do you write medication? No. As a chiropractor, we do all the standard things that your general physician does, but we practice in the realm of physical medicine. Guess what our job is? Our job is not to cover nothing up. Our job is not to hide nothing. Our job is to locate, analyze, and guess what? Fix your condition. Don't hear that a lot, okay? Our job is to do it without surgery, to do it without medicine, to do it without all these braces. You come in and you go through the rehab, and guess what? You get your normal life back. So I want to kind of cover some basic things that happen after the examination. X-ray findings come back and we've located the problem, and then we do what's called a plan of care. Is, hey, when do I come in? So let's just give an example of, say you have a hip flexor injury and you're around 33 years old, and I've decided to see you twice a week. Well, we'll see you twice a week for 2 or 3 weeks until we see an improvement, and then we start backing off care. Just like if you go to a dentist and he says, guess what, you need braces, and you go every week and they tighten those braces up. Well, eventually you don't see the orthodontist no more, because guess what, the teeth are straight. Same way with chiropractic. Once we correct that misalignment and fix that problem, we release you. A big misconception is, hey, once you go to a chiropractor, it's forever. That's not true. Once we get the problem fixed, we actually release you. I see those patients from time to time, but it's always a new condition. I kind of want to go over some basic things, because there's a fear factor of, hey, are you going to pop my bones? Are you going to stretch me? I've seen things on YouTube or certain things. There's a lot of things that you may see on different forms of media that are just so far from the truth. We're very gentle on how we approach the condition. We adjust with low therapeutic type of techniques. We also use instruments on smaller patients, younger patients. We see children very young age, from 3 to 4 months to 2 or 3 years to 99 years old. So it don't matter what your age is, what your condition, chiropractic is safe for you. Kind of want to go over some basic instruments that once you get here, that way you'll understand, hey, what is this thing doing that's making me feel so good? The first table I kind of want to show you This is kind of a standard chiropractic table, but it's got some special techniques. It's a decompression table. So you've heard all these people say, hey, I got a bulging disc. Well, a disc is a padding in between the bones. And once a disc bulges, it doesn't get bigger. It's like a tire that gets a flat. So once that padding becomes kind of compressed, we will actually place you on a table, such as this decompression table, at a specific point. It will start to stretch, and it will elongate, stretch that disc back out to its normal configuration. Now, this is like a balloon full of water. So while you're on this table and this table is stretching you, we also use what's called a therapeutic ultrasound machine. This machine has two little controlled nodules in it that actually vibrate together and produce an ultrasonic sound wave. And this, what time you're being stretched, goes right over the disc. And this is constantly being moved with a liquid medium. And what this does, it puts sound waves back into the disc, allowing the disc to actually pump back up. It's kind of like if your car had a flat tire, and this is a can of Fix-A-Flat. It actually puts that fluid back in there. And at the same time, it actually removes that inflammation that's causing you that much pain. We also can use electrical stimulation that controls muscle spasms. And I'm sure that if anybody's had back pain, you know and verify what a muscle spasm is. It's terrible. You move suddenly and you grab your back, and guess what? You're done for 2 or 3 days. Well, from a chiropractic standpoint, if we can get to that real quick, we can remove that pain, and guess what? You can go back to work, you can get back to your normal life, you can go see your son or daughter play baseball or softball. So these are some commonly asked questions, and we want to get on here and just kind of give you some informative information of what to do. So if you're out there and you got a question such as this, you treat back pain, you're a chiropractor, is there anything else you do? The list is ongoing. Any type of shoulder pain, elbow pain, carpal tunnel, knee pain, wrist dysfunction, ankle pain. Do you work on anything such as fingers? Yes, we do. We see a lot of sports injuries, a lot of work-related accidents that not just involve the shoulder and appendage, but actually even the fingers. So it's kind of limitless what we can do. So the best thing you could do is let me examine you. Let me look at your case history. Most of all, this is where the pain ends and the healing begins. So, hey, if you're out there and you're struggling, you've been to doctor after doctor after doctor, and you've got no answer, guess what? The number one thing we do here at this clinic, we listen. We listen to you. And guess what? We give answers and we explain. And my biggest motive is you will not leave this clinic until you fully understand what is wrong with you and what your options are. So as a physician, that's my number one priority, is to listen, to examine, to make a correct diagnosis, and to actually give you options as a patient. So hey, if you need a chiropractor, call me, 432-8395. May the Lord bless you. In the next video, we will answer some further asked questions.